The headline in the Dallas Morning News sounded ominous. More job cuts at the largest healthcare nonprofit in Texas. The cuts at Baylor Scott White had started coming with some regularity since the COVID pandemic hit the healthcare sector hard.
So the bottom line is it's been a very difficult and challenging years for the hospital sector. Somewhat ironic in that they've been in the news more and more important to our economy than probably at any time in recent memory. But they've had to do it under some very difficult economic circumstances that are requiring some pretty substantial adjustments.
Healthcare jobs in Texas had already taken a huge hit, and the moves at Baylor Scott White had helped bolster its balance sheet while keeping its payroll largely on par with the last several years. This time, the company aims to cut overhead, or jobs that don't directly relate to healthcare. In Central Texas, that amounts to just under 200 paychecks, 2/3 of which will get jobs with the company where the health system will send its IT, accounting, and billing jobs.
And the other 60 employees or so will be absorbed back into Scott and White, through retraining and repurposing for new jobs for them.
And that's an important clue. Does this reorganization mean Baylor Scott White plans to pull back and shrink its footprint? Company leaders say not at all. They say they plan to expand with a branch campus of the Baylor Medical School right here in Temple. In a statement, the company said, "Our goal is that every employee involved with this transition will be offered a comparable employment option inside or outside the health system, and no one will miss a paycheck because of this transition." The company believes, as do experts, that the shifting of resources to patient care will strengthen Baylor Scott White and help prepare it for what's sure to be some bumpy times ahead. In Bell County, Dennis Turner, 25 News.